So let's talk about the business model now. There are 4 distinct revenue streams in the HODS business model. So let's start first with the first revenue stream. We help you establish within your practice a diagnostic component. So you start testing your patients. You provide testing to your existing patients. No additional marketing required. You bill the insurance company, and you get directly reimbursed by the insurance company for these codes that I described to you that are outside of the physical therapy universe of codes, and you are allowed to bill these codes, and you get paid 3 to 10 times more than you made from a single visit of physical therapy. Okay, so this is the first revenue stream. Now, let's discuss the second revenue stream. You're going to have a territory of exclusivity. So in this territory of exclusivity, there are many physicians, podiatrists, chiropractors, other physical therapists who are not members of HODS, and they will not be able to be members of HODS if you are a member of HODS in that territory, because you get a territory of exclusivity. So now all of these providers, when they want their patients to receive diagnostic testing, where do they send them? They send them out to some diagnostic center. So they are losing money. They are not making any revenue from this. And besides that, patients sometimes wait for weeks and weeks and weeks to get either an EMG or an ultrasound test. So instead, what we do is we offer a solution. We help you create agreements with these physicians where you and your staff go to the physician's office or the other physical therapist's office or the chiropractor's office or the podiatrist's office, and you perform testing on their patients inside their offices. So the physician now bills the insurance company. So they bill the insurance company, they collect the money from the insurance company, and they pay you a negotiated testing fee for service. So that is your second revenue stream. Your third revenue stream. Now you are in all those physicians' offices. You are performing testing in their offices. Well, where are these physicians going to refer their patients for physical therapy? That's fantastic. You are making additional revenues from getting referrals from those physicians who send their patients to you to get physical therapy services. So that is a great referral program for your practice to get physical therapy patients. And revenue stream number 4, direct access. We are helping you and we are doing for you direct access marketing for patients to come to your office, to your practice, to your HODS-approved diagnostic center for diagnostic testing and eventually for physical therapy. You bill the insurance and you get paid for these services. So I'm going to show you a quick video on how all this works. All right, here we go.
The HODS prescription to help patients and advance your practice to the future of PT. Massive numbers of people receive information about their back, shoulder, knee, or other problems via social media campaigns. They get directed to www.findbestpt.com, where they choose a HODS-approved diagnostic physical therapy center. Patients arrive and receive a proper evaluation that may include the use of diagnostics such as EMG and ultrasound imaging testing. The physical therapist creates an accurate treatment plan using both data from clinical examination and diagnostics. This plan addresses the patient's real cause of problem with 62% better accuracy. Patients get better faster and they are able to regain back their function. Then they recommend the services to their friends, family, and their doctors. And this is how we create a huge positive impact to society.